Bienvenidos y bienvenidas a Frugal for Health, una iniciativa que busca dar a conocer proyectos frugales de todo el mundo. Si esto de la innovación frugal aún no sabes de qué va de conseguir más con menos. Y te dejo un vídeo de Navi Rajau que lo cuenta muy bien cómo hacerlo en el sector salud y social. Hoy me encuentro en Kenia, en Nairobi, para conocer la empresa HealthX Africa, una empresa que está revolucionando el mercado de la telemedicina con una propuesta exageradamente frugal. Lo hace poniendo clínicas dentro de cabinas en zonas remotas y las conecta con un call center aquí en la capital. Hemos podido conocer estas clínicas en la zona rural y ahora estamos en la capital para entrevistar a su CEO y que nos cuente un poco cómo funciona este proyecto. Espero que os guste la entrevista y si queréis un poco más, abriremos un debate con algunas partes interesadas en el proyecto. ¡Hasta pronto!
Hi there. See you. My name is Roy Bore and I'm the CEO of HealthX Africa. I've been here 2 years now. I joined from being the Chief Financial Officer of the largest bank in Eastern Central Africa to join healthcare. I'm a finance professional, so this is a new journey for me. And I'm here because of two things. I think there's a huge need for someone to transform healthcare, not only in Kenya but in Africa, and also will achieve great success in terms of improving the economic livelihoods of people, because health is one of the biggest challenges that is causing people not to succeed. So I'm really excited. Frugality means being able to achieve more with less, as you've mentioned. And I think it's important in healthcare in Africa because many people cannot afford to access healthcare. So how do we do more with less so that we're able to provide healthcare to a very big population with less resources? Means it will be more affordable and it can reach more people. So telemedicine in Africa has big potential because mobile penetration is high. Actually in Kenya, we have a population of 53 million people, 55 million, but we have more phones than people. We have 65 million phones. So if you think about access to healthcare, there's opportunities for telemedicine to reach the whole population. You think about the current problems in terms of the number of doctors we have, there's very few facilities. The average distance to a health facility in Kenya is 5 kilometers. So people cannot access healthcare. Telemedicine is the answer. The last problem is people cannot afford healthcare, meaning if you make it expensive for them to access, it's a big problem. So with telemedicine and adopting this technology for Africa, we are able then to be frugal by ensuring that people do not only need smartphones, but they can also use toll-free numbers to deliver or access telehealth. So telehealth, telemedicine is the way of the future. So HealthX has a unique approach to telemedicine. We realize that many players in this space, and there are many, use telemedicine in the Western form to try and execute in Africa. HealthX has adopted it to the African context. Number one is what you've seen in Bomet, where we have a fully off-grid telehealth solution. It has solar, it is weatherproof because it's a steel structure. Then it has inverters, meaning you can store power. Because of this, then we have fridge, meaning we can store medication and we can store blood samples. This facility is manned by a nurse. They're able then to do triage. So a patient comes in, they get their pressure checked, temperature checked, but then the doctor they see is connected virtually through a screen, which I'm sure you saw in Bomet. So they connect to the doctors sitting in Nairobi. We have employed in Nairobi doctors who speak multiple languages, meaning we are able then to connect even in local vernacular, local language. So it's a very unique solution that we're doing in HealthX because we're able to deploy these solar-powered virtual clinics in rural communities. So the government or any other partner does not need to build brick and mortar facilities. You can drop these things and you can be able to provide healthcare in very rural communities. And to give you some numbers, Kenya has 47 counties. We are serving patients in 40 out of the 47 counties. So we are having access to everyone across board and in the bottom of the pyramid because we are democratizing access to healthcare.
My name is Nelly Chepkirui, a nurse from HealthX Africa. This clinic was opened in January, that is this year 2024. So we have been here for about 11 months now. The patients that we receive are from the employees from the Ndaraweta, that is we can receive like 5 to 10 patients a day. Then from the community we do receive 3 to 5 patients a day. In Ndaraweta, it's generally cold. The temperatures here is generally cold. So the normal the diseases that we normally see is pneumonia and asthma. Most of them do come here as patients. We give them healthcare services at an affordable prices. The process here is when a patient comes, I do take the personal details, I register them on the system, then from there I take the medical history, then from there we do the vital checkups, that is the temperatures, PO2, the blood pressure, then I link them directly to the doctor. That is via the toll-free number, video call. Yes, that is that. Most of the farmers, mostly that we have right now, are unable to come here. So mostly they do make calls at home. That is by our toll-free number. And they normally have that toll-free number. They are connected to the doctor. Then the doctor gives them prescription at their home. Yes. Then whenever they are given prescription, some do come for the medications here. From here, okay, the farmers have really got benefited to these services because most of them could not afford to have medical care. So most of them had to travel, that is around 8 kilometers away from here. That is, it was hard for them to get that medical services. So for now, today, they have really appreciated that we are here in the Raweta. They get services at their home and they're happy.
So normally what we do is we look for an anchor tenant. Like in the case of Bomet, we have put the virtual clinic inside a tea factory. The company, the tea factory, will then pay us a subscription fee for all the employees. This helps us to cover our basic costs. For example, the salary of the nurse, the cost of internet, and the cost of providing medication on site. Then we provide service to the whole community where they pay a very small fee, less than $1, where then they can be able to get a consultation with the best in class doctors. This is the same doctor you will be able to see, I will be able to see, but then we are providing access to the rural community. Then they would end up paying for the medication, assuming they don't have insurance, but we also have partnered with the government through the national health insurance. We call it social health insurance in Kenya, where they're able then to use the social health insurance to access medication, labs, and the consultation fees. So very affordable, but best in class quality care. We started in 2021, so it's been about 3 years. It's been a very interesting journey because initially when we started, the target was not bottom of the pyramid. We were targeting the urban population who are insured. But with time, we asked ourselves, where's the need? And the need is the rural communities. But the biggest problem why people are not going to rural communities is affordability. They cannot afford. So you have to think innovatively of how do you provide healthcare in those communities. So HealthX Africa is quite unique because nobody else is thinking about telemedicine for rural communities. We feel we have cracked the model and we're providing healthcare at scale to these communities. At scale means we are doing about 800 psychology consultations a month. We are doing almost 3,000 consultations for general medicine in a month. We are then providing, we're handling about 80 to 90% of these cases internally, and we are referring about 20% to third parties, because if you have a broken leg, for example, we refer you. So the impact is quite amazing because we are seeing now patients improving, especially with chronic illnesses like diabetes and hypertension, but also rural guys, rural communities who are not able to access any form of care. We're providing this to them. So the impact is quite huge in terms of numbers, and we are seeing 2025 being a very exciting year because now we are scaling the model. We are aiming to reach over 1 million people this year because of various things that we have established, for example, partnerships with the largest telco and a few government agencies. Those virtual clinics you saw, we're trying to put them in public schools. We're already doing it in private schools. And these schools will also become hubs to serve the local community. So the same model for Bomet, and the impact is amazing. The world is becoming more African because when you look at the population contribution of Africa to the world population in 1950, it was 6%. Now in the projection by 2050, Africa will be almost 30% of the world population. When you look at population growth now in Africa, out of the top 8 highly populous countries by that 2050, 7 of them will be in East Africa. So we are looking to expand within East Africa. Some of the biggest population countries during that time in terms of growth will be DRC, there's Tanzania, there's Ethiopia, and these are countries which are very close to us. We are planning to move into the second country this year, 2025, and we'll move into 7 countries by 2027. So we have ambitions to grow and we're starting this year. So So as I mentioned, number one, the biggest barrier is regulation, because most countries would require you to hire doctors who are licensed in those countries. You're required to have country-specific licenses. It would be great in the future if we could run a telemedicine hub from Nairobi, for example, serving the region. The technology allows it. Why can't we do that? So regulation is one of the biggest challenges. The language barriers I've mentioned, you have to have doctors who can speak many, many different languages. Kenya, for example, has 42 different tribes. We cannot hire doctors from all these tribes. Now you can imagine if you expand, you need doctors who speak Amharic for Ethiopia, who speak Kinyarwanda for Rwanda, who speak the local languages of each of these countries. So that's another problem we are anticipating, but the solutions then are there, which we're thinking around AI. Because if you have chatbots and you have AI, it's very easy to train an AI model through a chatbot or an avatar to then deploy and speak in any of these languages. It's very easy. We can even get it to speak Mandarin tomorrow. But the beauty of getting AI, which is anchored on Kenyan-specific, African-specific data, is to be able to then provide solutions which are specific to this context. And we're already on that journey. Our proposal is simple because our technology is simple. You don't need to go through a long process of downloading an app for a sophisticated customer. A sophisticated customer with a smart iPhone or an Android can be able to download that. The kind of customers we are serving require simplicity. They only require to call a toll-free number. They can be able to access our service. Simple. We are partnering with all existing players in this space, both private sector and public sector. We don't believe in uprooting and changing the whole place. So we have partnered with government facilities, we have partnered with private facilities, and we're able to provide care through our hub and connected to the existing infrastructure. So this way, we don't need to spend a lot of money, we are being frugal, and as a country then, we are able to leverage on existing resources, connect these different partners, and be able then to provide care through partners. So when you think of Africa, Kenya, that is where the population is. The population is at the bottom of the pyramid. If you're not looking for a solution for this place, then you're wasting time or you won't have impact. So HealthX Africa is really playing in this space because we're thinking of middle to bottom of the pyramid, and healthcare for us is only going to achieve universal healthcare if we focus on these people. Our vision is a doctor for every Kenyan. We're going to change this in the near future to be a doctor for everyone because we want to grow beyond Kenya. Thank you very much for visiting us. We believe that through the work you're doing, we're able to then connect different players across this marketplace. It's surprising that there are so many people who are providing solutions which we could benefit from and we don't know. So it's nice to see your growth and your journey. We'll be here. We're waiting for you to come back and see how far you go.
Ponemos punto y final a la entrevista con Roy, el CEO de HealthX Africa. Ha sido súper interesante poder conocer este proyecto y desplazarnos hasta la zona para conocer las cabinas. Espero que os haya gustado y si queréis un poco más os dejo un debate para profundizar sobre el tema. ¡Hasta pronto!